dying because they're sitting in the emergency room saying, I have chest pain, and everybody's ignoring them. Well, my commitment to you is I'm so focused on bringing up doctors and nurses from our community so that when you walk in, you're seeing somebody like you who you know you can trust and will understand. Apart from that, Intermountain is doing a lot of work around diversity, equity, and inclusion, and it's a mandatory training that all of us have to go through so that they understand that continuing in this kind of inequity when you're taking care of patients is just not going to be tolerated any longer. So please, I need everybody to have way more confidence when they are going to seek health care, that they are going to be listened to. Times have changed.
Right. Again, give us a call if you have any questions. 702-647-3688. That's 702-647-3688. We want to hear from you. Well, what is your feeling about the healthcare system right now in Las Vegas? I know, Dr. Brobbey, a lot of people say the best waiting room is at McCarran Airport. I mean, you always hear this because, there is a lack of trust with the medical industry here in Las Vegas. And I don't know why, because I remember the first African-American doctor here was Dr. Charles I. West, who was my godfather, and he was a splendid doctor and took care of everybody in the community. I mean, if you had money or if you didn't have money, he took care of you. But again, I think we have an excellent healthcare system here in Las Vegas. But what do you say to that when people say, I'm going to go wait in that McCarran Airport waiting room instead of the medical waiting room?
It breaks my heart when I hear that, but I understand. When it comes to per capita, Las Vegas has one of the lowest rates for primary care providers. But apart from that, the reason why even some of us in the healthcare field will use McCarran as a waiting room is lack of tertiary facilities, right? We don't, unlike California where they have the UCLAs of the world, we really don't have that kind of tertiary facility care. And so if we have a very complicated case, we have resorted to sending them out of state, out of use, to mainly before it's been California and Arizona being the closest. Unfortunately, it's not coordinated care, right? So I send my patient to UCLA for care and we are not able to get information back. So one of the things that we're so excited about Intermountain is that we are part of the same company that is based out of Utah. So that lack of coordination isn't there with Intermountain. And so when I send a patient to Utah, I know that my colleague is the one taking care of the patient. They're sending me information back. We're going back and forth, and we're really taking it's an integrated, coordinated care that we haven't had in the 20 years that I've been in Las Vegas. So I'm really excited that finally, even though we're still using McCarran, and the goal is to bring all that tertiary care into Las Vegas, for now, at least there's coordination and integration of that care.
Yeah, okay. Again, give us a call back. I know we had a few calls on hold, but call us right now at 702-647-3688. We're talking about the Las Vegas Black Image Magazine and Intermountain Healthcare's health initiative. And this is going to be going on, going into almost December, because we have a lot of activities, a lot of health symposiums that we're going to have planned for you to come out, interact, meet the doctors that can help you with your healthcare needs. Again, Intermountain Healthcare, you can give them a call at 702-318-2400. That's 702-318-2400. And we're here with the Chief Medical Officer for Intermountain Healthcare, Mrs. Dr. Brobbey. And again, we're just so happy that you're here with us. But right now, everybody is talking about the COVID vaccine, and especially with them in our community. Some people are getting the vaccine and some people are not doing it. And that's really something that, as we saw the demise of Dr. Colin Powell, and he got, COVID. He had a lot of pre-existing conditions,
yes,
but he did get COVID, and
yes,
and that was really the downfall for his health. But what do you have to say to people about having reservations about not getting the vaccine?
So I've actually been doing the rounds trying to hear from people, because this is really a life or death decision people are making, and we need to take their concerns seriously. I don't want to be dismissive of anybody's concerns at all. People are concerned that it was created too fast, Operation Warp Speed, and that is such misinformation. They've been working on this mRNA vaccine for almost 10 years now. If you guys remember SARS, almost a decade ago, that's when they started working on it. Actually, they've been working on moving the flu vaccine into this kind of mRNA vaccine, because you guys might not be aware of it, but the flu vaccine that we all happily take every year is sometimes less than 50% effective. A lot of the times it's between 35 to 45% effective. And so we knew that we had to come up with a much better vaccine. And that is this mRNA vaccine, which is over 90% effective. And so this has been going on for years, almost a decade in planning. So it is not something that was just whipped out and they didn't do enough research. I promise you the research was done. People are concerned about all the side effects, potential side effects. And again, I'll say to that, worldwide, not in the US alone, worldwide, over 2 billion people have gotten this vaccine. And if there were significant side effects, there's no way it wouldn't be all over the media right now. And so if you look at the pros and cons, the long-term effects, and we're still learning about long-term effects every single day, new ones that crop up every day. What you will get and have to live through potentially for the rest of your life from actually getting COVID itself versus the 2 days of fever and muscle pain that you get from the vaccine, you can't even begin to compare the two. If the vaccine didn't work, then we'll see that the people dying in the hospital will be the same, vaccinated versus unvaccinated. But there's a huge difference, right? The percentage of people dying unvaccinated is about 80% more than those dying with the vaccine. And like Colin Powell, they have underlying conditions. Okay, I had a dear friend whose 46-year-old husband, no other preconditions, died just last week from COVID. He was not vaccinated. Okay, so I can't emphasize enough that it's a no-brainer. Please go get vaccinated. If you're waiting to see side effects, well, you've had 2 billion people go ahead of you. You can tell that it's safe. Please get vaccinated.
Yes, I agree. And it's not bad at all. When you go, and I said personally, my personal experience, I just got the shot and I went on about my day, had nothing happen, no loss of energy, and it was something. Now our children, they're saying that our children are going to start getting the vaccine. Right?
Yes. Yeah. We're expecting that Pfizer will get the approval. FDA will give the approval very shortly for children 5 to 12 years of age. And the booster, if you got the Pfizer shot, please, if you're eligible, go get the booster. We're hoping that Moderna will be given the green light very shortly to give the booster as well. The effect of the vaccine wanes over time. That's why we give a flu shot, for instance, every single year. And there's an opportunity for the booster to, kick up your immunity again. And so if you're eligible, please go get the booster shot as well.
Yeah, especially for our seniors.
Especially for our seniors.
For our seniors. And if you're a senior and you're listening, please call us if you have any questions about getting the flu shot, getting the vaccine, and then getting the booster. There's 3 things here that we're talking about. And sometimes people are getting scared about taking all of that. I know there is a waiting time after you get the vaccine, then there's a waiting time, and then you do the flu. Or what is the waiting time with that?
Now there's no need to worry about a waiting time. Okay, no need to worry about that. And it's available anywhere. You walk into any Walmart, Walgreens, CVS, just walk in, no charge to you. You can get vaccinated. Please. Right. We are trying to make it as simple, demystify it as much as possible. You need to get the vaccine.
Again,